Hi, I'm Dr. Siegel, and if you're watching this video, we've probably already spoken a little bit about surgery. But what I'm going to do here is I want to review things so that if you have other questions, you can remember what we talked about, you'll be able to refer to this. So what we're talking about today is septoplasty and turbinate surgery, and we typically do that surgery to help people breathe better through their noses, to get rid of facial pressure, and sometimes even to get rid of snoring. So what we're going to talk about today are the structures here. You can see this is the septum, which is a wall that separates the right and left sides of the nose. And sometimes that's bent to one side or deviated. That's another way of talking about it. And whichever side it's bent to, that side typically is blocked. And I'll show you that on a CAT scan in just a few minutes. And the turbinates here are the structures that warm and humidify the air in the nose. So the turbinates will swell and shrink based on temperature changes, allergies, or even your position in bed. If you notice when you're laying in bed, the side of your head that's on the pillow will typically congest because the turbinate will swell on that side and you'll be very stuffy and you'll breathe all through the nose. That's the part of your nose that's on the other side that's up in the air. This is a side view of the turbinate. You can see it goes the entire length of the nose. And what we do with the surgery is we can do it in many different ways for anesthesia-wise, but we'll talk today about general anesthesia. And what we do is we bring you to our surgery center. They'll put an IV in your arm, and then you'll come into the back, and we'll give you all the medicine to put you to sleep through the IV. And then you'll, once you're asleep, they'll put a breathing tube in. That's actually the safest form of anesthesia. And then all the surgery is done through your nose. And the first thing we'll do is we'll go in and we'll address the turbinate that's enlarged on the opposite side of the deviation. So we'll shrink that down so that when we center the septum, we don't just block the other side. So we get in and we shrink it from the inside out using a debrider. And what that does is it preserves the mucosa overlying the turbinate so that there's no dryness that occurs. And there's no loss of mucus or any issues there. And there's also very little bleeding. I've never had a patient bleed from the lower turbinate when we use that technique. There are other techniques where they use radiofrequency to burn the turbinate, but that typically leads to a less exact result and typically a little bit more congestion post-operatively. So I don't really use that technique at all. And then once we're done shrinking the turbinate, we'll push it out just a little bit, and you'll see in the CAT scan why that's important sometimes. So we'll push it out so the airway opens up even more. The next thing we'll do is we'll make an incision, usually on the side of the deviated septum, right here in the front of the nose, right in here, in this area here, and we'll go in, we'll lift up the membrane on one side of the septum, go through the cartilage in the inside, and then isolate the area that's bent, remove it, and then sew it up, close it up. The whole procedure takes about an hour and 15 minutes. In the recovery room, you'll end up noticing immediately that you're breathing through your nose. You'll also have some burning in the nose for about 2 hours or so. There's not a lot of pain associated with this surgery. And you'll have some bleeding for about 8 hours after the surgery. There'll be a little pad under your nose. We do this on Thursdays typically, and over the weekend you're just very congested, a lot of pressure, you're very tired, and that's really a general anesthetic thing. By Monday you're starting to feel a little bit better. We're having you use saline in your nose constantly, or every hour for the first week. And the reason we do that is because the bleeding, if it clots in your nose and dries out, your nose is very congested. With the saline, what you're doing is loosening all that up, and it reduces the risk of bleeding and also makes you much more comfortable. One of the biggest risks of the surgery is bleeding from the septum. Usually the back of the septum, there's some pretty big blood vessels, and you can get some bleeding there. So that's why we have restrictions for 2 weeks after surgery. There's no bending with your head lower than your heart. No lifting more than 15 pounds, or we don't want you bearing down. And we don't want you to travel outside the area, not because travel is bad, but because if you're outside of the area, then we can't get to you if you have any problems. And you'd probably rather come back to see us if you have an issue rather than someone else. You're going to come back and see us a week after the surgery, a week and a day after the surgery. And there we're going to go in and clean out some mucus and crust so that you can start to breathe a little bit better. Most people go back to work Monday or Tuesday after the surgery. And then after you see me that day, you can go about your normal day there. Usually you're not in any pain after we're done with the cleaning of the nose inside. And then you'll come back again in about 3 weeks, and you'll notice that 3 weeks after the surgery, you're really breathing quite well. So that's good. I'm sure there are other questions I haven't answered, but what I'm going to do is I'm going to have some separate videos we'll kick away to, and I'll show you on the CAT scan where the deviated septum is and what it looks like on the CAT scan, and some other abnormalities like concha villosa or swell bodies, which are seen a little bit better on the CT scan. Okay, thanks for watching.